Today we're going to talk about the gastrointestinal system. I want you to first of all notice the order in which we do this part of the physical assessment. We're going to inspect, then auscultate, percuss, and the last thing we're going to do is palpate. The reason you do it in this order is because if you percuss or palpate prior to auscultating, it could distort the bowel sounds. So let's talk about inspection first. We have posture, abdominal splinting. Another word for splinting is guarding. So if you see somebody that has abdominal pain and you go to touch them, you'll notice they'll guard it. They'll try to protect them. Okay? Striae, those are stretch marks. You're looking at the shape and the contour of the abdominal cavity, whether there's symmetry. Distension, which would be like a bloating type thing. It can be caused by gas, a tumor, ascites. You could have full of feces. Okay. The oral mucosa, you want it to be pink and moist. If it's pale, it could be an indication that they have anemia. Then we are going to auscultate. Okay. With this one, we are going to use the diaphragm of the stethoscope and listen for bowel sounds. Now, the bowel sounds that you hear are from what's called peristalsis, and that is the movement of food through the intestine. Okay. Now, it's important to note that the pattern for auscultating bowel sounds, you start in the lower right quadrant, then the upper right quadrant, the upper left quadrant, and the lower left quadrant. Normal bowel sounds occur approximately 5 to 30 times per minute, and these are gurgling sounds that you'll hear. Okay. Bowel sounds are either, of course, normal, which is 5 to 30 times per minute. You can have hypoactive bowel sounds, which you hear them less than 5 per minute. Use of narcotics, a paralytic ileus, bowel obstruction, or peritonitis can cause this, and it's an indication of decreased peristalsis. Hyperactive bowel sounds are those that occur greater than 30 per minute. Diarrhea, constipation, or laxative use can cause this, and it indicates increased peristalsis. Now, if you do not hear any bowel sounds, you have to listen for a total of 5 minutes. The next one is percussion. We are percussing, we're trying to find underlying organs or masses in the presence of air or fluid. When we palpate, the abdomen should be soft and non-tender. So you're going to go over each quadrant. You want to detect areas of tenderness, distension, masses, or a fluid accumulation. It also helps to determine the size, shape, and position of organs. Now, you do not want to palpate a pulsing abdominal mass because that could be an abdominal aneurysm. The questions you want to ask them: do they have any nausea or vomiting, constipation or diarrhea? How's your appetite? Do you have any heartburn? How are your bowel movements? And do you have any problems with chewing or swallowing? And that's it.
Ready? Okay, we are going to auscultate the bowels, and then we're going to palpate. Okay, so remember, when you auscultate, you want to start in the lower right hand corner and go lower right, upper left, lower left. Look for the belly button. Where's our belly button? There it is. And then those are your 4 quadrants. Oh, I am hearing a little Starbucks. Okay. Then you're going to palpate. Does that hurt? No? Okay. When you palpate, you don't want to run your fingers across. You want to lightly push on it and then pick your fingers up and then press again. Okay? You're feeling for organ borders or any tumors.